Hi everyone. Thank you for watching our first two videos on Innovaccer's Health Cloud solution for medtech. In this video, we are going to understand more about the third part of the solution, focused on generating patients' unified health records. In a way, we are going to talk about the engine under the hood that powers the applications such as InConnect, InCare, InNote, and InGraph that you saw in first and the second video. Data Activation Platform, or DAP, is capable of ingesting from different sources, be it connected medical devices, EHRs, claims, labs, medication, etc., and integrate these disparate sources, then longitudinally link them and create a unified view of patient. Innovaccer's customer engineers or data analysts can set up DAP on behalf of a medical device company and then calibrate the platform to source patient data from each provider customers. There are three parts to this solution. First is DAP itself, where we will see how the data gets ingested. Second is function as a service, or FaaS, where we will see scalable operations can be performed on ingested data. And the third one, which is developer portal for independent application created on top of DAP. Let's begin with the DAP. So on the landing page of the app, you can create workspaces for all hospital sites who are customers of medical device company. You can create workspaces for each of these customers. For example, in this case, let's try creating a workspace for Neutrino Clinic. Once this gets created, it asks you to use the templates. Over the years, we have worked on creating several templates based on different type of sources of information that we have ingested. So we have so far ingested 80 plus EHR sources, and we have templatized all of them. So in this case, let's use one of the templates. We can further customize the templates within a template. So in this case, I've picked up few of the categories, and then I'm trying to create a workflow. For each of these category picked, I can dig deeper and use this user-friendly workflow that can source data and transform them via Innovaccer's library of parsers and connectors. Then do semantic normalization, data quality management, and finally, longitudinally link them to generate patients' unified health records. So let me publish this. It asks you for scheduling, so you can schedule based on the requirement. So DAP, data analysts can keep a tab at the integration process as well. So in this case, this tab helps them do that. They can evaluate the progress at a site level. For example, it looks like there were 220 sites that were integrated or requested for integration. 56 of them have been integrated so far, 124 are ongoing, and 40 have not been started. They can go to each of these line items, which represents one of the hospitals, and understand which stage of integration are they in. Not only this, they can go to data quality and examine the data quality at the provider level, at the site level, in fact. For example, this facility is being ingested and it has 55% gap in the procedures. They can dig into each of these hospitals. For example, in this case, looks like that 55% gap was attributed by 34% of invalid record and 11% of the blank records, and then take appropriate action for each one of them. Not only this, there is a data profiling tab, which helps the data analyst to visualize aggregate level information. So in this case, for example, in this case, looks like so far 15.3 million patient data has been ingested already, which is nearly about 10% of the covered US population. They can go to procedure level information. For example, in this case, this particular procedure, about 791,000 members have been, the data for them have been ingested in the data activation platform. But what if the ingested data needs to be used to run analysis? So for example, if a medical device player wants to evaluate the risk of surgery for each patient at all its customer hospital sites, they can use FAS. It enables rapid scalable calculations on the ingested data to enable insights that are used to populate dashboards such as InGraph that we saw in the second video on analytics for hospitals. In this case, Fast UIs allows you to add a function. And here I'm adding one of the functions. And then once you add the function, it allows you to allocate resources from this UI itself and then deploy it. They can schedule the operations from this tab and finally use the logs to evaluate how the process has run or failed or completed. Apart from this, we have embedded a developer platform that allows medical devices to custom build their application on top of Innovaccer's tab. So this could be a UI enhancement to Innovaccer's application to deliver contextual content, such as having an enhancement in the InNote, or this developer platform can be used to use Innovaccer's platform APIs to push or pull relevant customer data required to power their own applications. Or they can simply utilize DAP as a primary data aggregation and interoperability platform to connect with disparate data sources. This developer platform provides the opportunity to build and host an application. We must provide this information that developer portal is a work in progress, but it aims to provide a method to create and deploy partner applications on this. Thank you.